Hi Nimrod, it's so very nice to talk to you here. I'm very happy to introduce Nimrod Muhumuza, who is Head of Research at Afya and Haki. And again, we are coming out of our evidence session, and I would love to hear a little bit of summary what we talked about in relation to the role of evidence in legal action.
Thank you so much, Esther. So we had a very good session about the need for evidence, the need for positive evidence to support legal cases and litigation. We have very good cases from the continent, from Kenya, where judges have recognized the impact of restrictive SRHR laws, relying on evidence that shows that these restrictions affect poor women with disadvantaged backgrounds, economic backgrounds, and they have ruled to loosen some of those restrictions. If we don't do that, we also have, unfortunately, some bad examples, and one of them is from Uganda. We have a court case in the Constitutional Court where the judges upheld the Anti-Homosexuality Act based on very, very shaky evidence. So it is very, very important for activists, for advocates, to make sure that the evidence that we present in court for action, one, is community driven. We do not need top-down approaches. We need communities to mobilize. We need to center the voices of communities, because whenever we've done that, we feel that has always worked.
Can you give a specific example of
Yes.
actually using the public health evidence work?
Yes, so the Kenya case, FIDA versus Attorney General, there was a mobilization of evidence again that showed the impact of restrictive abortion laws on poor and disadvantaged women. We also have a case from Uganda, Petition 16, Sehad versus the Attorney General, where judges also relied on extensive evidence, public health evidence, on maternal mortality, on the impact of health financing, the impact of gender-sensitive budgeting, to rule in favor of the applicants who had asked that government be obliged to take all measures necessary to reduce maternal mortality, to make sure that the health sector is adequately funded, and to train more health workers.
So what can we do better than the public health and the legal and judiciary community works better?
I think, so there are three things that I can think of. The first is to make sure that we cooperate together. The lawyers must work with the communities to make sure that, again, we center those voices and make sure that we produce accurate and culturally resonant and sensitive data that we can put before the judges. And then we need to work with the judges. We need to train the judges. Yesterday at the opening ceremony, we had the Justice of the Kenyan Supreme Court, which was a very, very good and positive development to see, because they have issued a lot of positive rulings. So it's good to see them here. Then the other thing that I can think of is that as lawyers, because I think we're all lawyers here, we can't insulate ourselves from the community. We have to be driven by the community. And when the decisions come, the good decisions come, we must disseminate them in a manner that speaks to those communities and involve them in the implementation of those decisions.
Thank you so much. I really appreciate it.
Thank you.